A very good evening. Today the theory session that I will be explaining is about microteaching, titled The Germ Theory of Disease. Okay, learning outcome. By the end of this module, learners should be able to define the germ theory of disease, explain the historical context that lead to the development of the germ theory, describe the different type of microorganism, bacteria, viruses, fungi and their roles in causing infectious disease. And then we identify key scientists such as Louis Pasteur, Robert Koch and their contribution to the development of the germ theory. Discuss the role of hands in transmitting microorganisms and causing infections. Okay, introduction. The germ theory in medicine, the theory that certain diseases are caused by the invasion of the body by microorganisms, organisms too small to be seen except through a microscope. The French chemist and microbiologist Louis Pasteur, and English surgeon Joseph Lister, and the German physician Robert Koch are given much of the credit for development and acceptance of the theory. Although the germ theory has long been considered proof, its full implication for medical practice were not immediately apparent. Blood-stained frock coats were considered suitable operating room attire. Even in the late 1870s, the surgeons operated without mask or head covering as late as 1890s. In the 21st century, when soap was unavailable for removing common pathogens, disease-causing organisms or repeated hand washing had compromised the natural skin barrier, causing scaling of fissures to develop in the skin. Hand sanitizer in foam gel or liquid form were increasingly recommended. Although the effectiveness of hand sanitizer is variable, it is employed as a simple means of infection control in a wide variety of settings, from daycare centers and schools to hospitals and healthcare clinics, and from supermarket to cruise ships. Okay, next, the role of microorganisms in causing infectious disease. A few harmful microbes, for example less than 1% of bacteria, can invade our body and make us ill. Microbes cause infectious disease such as flu and measles. There is also strong evidence that microbes may contribute to many non-infectious chronic diseases such as some forms of cancer and coronary heart disease. Different diseases are caused by different types of microorganisms. Microbes that cause disease are called pathogens. Okay, so this is the infectious disease microbe that cause and type of microbe I will be explaining. So like cold means the type of microbe that causes this the disease is rhinovirus. Type of microbe is virus. Chickenpox is varicella zoster and virus. German measles cause the disease is rubella virus. Whooping cough, Bordetella pertussis, and type of microbe is bacterium. Bubonic plague is Yersinia pestis bacterium, and then TB, if not known as tuberculosis, Yersinia pestis, and the microbe is bacterium. So malaria is Plasmodium falciparum. The type of microbe is protozoan. Ringworm, the disease that causes Trichophyton rubrum, and the microbe is fungus. Adelix food is Trichophyton mentagrophytes fungus. Okay, so it is important that to remember that a pathogen is a microorganism that has the potential to cause disease, and infection is the invasion and multiplication of pathogenic microbes in an individual or population. Disease is when the infection causes damage to the individual vital function or system, and infection does not always result in disease. Okay, so to cause an infection, usually microbe must enter our body. So the site at which they enter is known as portal of entry. Microbes can enter the body through the four sites listed below. As you see, first is through our respiratory. As we know, it's nose or mouth. Okay, example like influenza virus which cause the flu. Okay, next is gastrointestinal intake. tract. So which is known as like for mouth oral cavity, and it's from like Vibrio cholera, which causes cholera, and then through our urogenital tract, such as Escherichia coli, which causes cystitis. Okay, so and then break in the skin surface, like we're having some wound or scar, right? It can cause Clostridium tetani, which causes tetanus. Okay, so next, to make us ill, microbes have to reach their targets in the body. Attached to the target site, they are trying to infect so that they are not dislodged, and then multiply rapidly, and then next is obtain their nutrients from the host and avoid and survive attack by the host immune system. Okay, next is we'll be looking at the contribution keys of the scientists to the development of the germ theory. As I said just now, Louis Pasteur, he contributed from 1822 to 1895. So he is the French chemist and microbiologist. So he disapproved spontaneous generation through experiments, and next he developed pasteurization to prevent spoilage and disease. Okay, so as we know, pasteurization means like pasteurize the milk like that. Okay, so Robert Koch next, he contributes from 1843 to 1910. He also is a German physician and microbiologist. Koch postulates for establishing the link between microbes and disease, identification of specific microbe causing tuberculosis and cholera, the importance and hand hygiene in preventing the spread of germs. Okay, as we know, hand hygiene is critical practice preventing the spread of germs and infectious disease. So that's why mostly we apply this thing in hospital every time we touch the patient, before we touch everything, right? So it plays a vital role in maintaining personal and public health. Here's why hand hygiene is important. So first is primary mode of germ transmission. Hands are common vehicle for the transmission of germs, including bacteria, viruses, and other pathogens. People touch surface and objects that may be contaminated, and then they touch their face, mouth, nose, eyes, introducing pathogens into their body. Next is we have to do hand wash, is because prevention of infection as we know, practicing good hand hygiene such as regular hand washing with soap, water can significantly reduce the risk of infection. Many illnesses including colds, flu, gastrointestinal infections, and even more serious disease like COVID-19, remember they asked us to sanitize our hand. So it's like that to prevent by simply washing our hand properly. So next is protection of others. By practicing proper hand hygiene, individuals can help protect others, especially those who are more vulnerable to infection, such as elderly people, young children, and individuals with weak immune system, especially like SLE like that So next is reduce healthcare costs. Effective hand hygiene can lead to a decrease in healthcare associated infection, resulting in lower healthcare costs and a reduced burden on healthcare system. Okay, next is workplace and community health. In settings such as school, workplace, public spaces, good hand hygiene can help prevent outbreaks of contagious illness. This is particularly important in densely populated areas where germs can spread, especially during COVID-19, right? You guys could see, right? Like each condo or whatever, each floor they'll keep the sanitize in front there like that when we go to shopping mall also we have to sanitize. So one of it global health preparedness. In the face of emerging infectious disease and pandemics such as the COVID-19 pandemic, practicing proper hand hygiene is one of the simplest yet most effective way for individuals to contribute to disease prevention and control. So the conclusion of this germ theory of disease stand as a monumental scientific discovery that revolutionized our understanding of health, disease transmission and medical practice. This theory, formulated by visionary like Louis Pasteur and Robert Koch and others, got many more of them, fundamentally changed the way we perceive and approach illness. In conclusion, the germ theory of disease has had profound implication. Okay, so paradigm shift in medicine. The germ theory shifted the medical paradigm from attributing disease solely to environmental factors or imbalances within the body to recognizing the crucial role of microorganisms such as bacteria, viruses and other pathogens in causing various illness. So next is prevention and hand hygiene. This theory is underscored the importance of hand hygiene, sanitization and disease prevention. It led the development of practices like hand washing, sterilization and vaccination, which have saved countless lives and significantly reduced to the prevalence of infectious disease. Okay, so the reference that I took is from here. Okay, thank you.
Madam, I got one question, madam. Okay, previously was mentioned about the hand washing important in healthcare setting. So normally in the healthcare settings, especially in the wards, we have 5 steps of the hand washing for the hand washing for using 7 steps for the hand washing, 5 steps for the and sterilize our hand. So so can you explain about a bit what you on your experience as a working as a staff nurse? What's your experience when every day the nurses or paramedics or doctors practice the steps to prevent the infection?
Yeah, definitely they have to prevent, because if not, especially when we're having the ESBL patient, CRE patient, you know, if we never wash and go and touch another patient, it would spread the whole ward. So we have to, and memang all the healthcare workers are practicing it.
Okay, Miss, another question. Okay, before and after COVID. So I want to ask you, so any data that showing that before the COVID, the hand washing, I mean implementation of the hand washing is effective, or after COVID also effective, which is a pre or after COVID? After COVID more people alert about this, especially healthcare staff.
I guess it's in your question already. Actually, most of not only healthcare staff lah. You see the visitors or patient also nowadays very concerned and very alert about the hand care. So nowadays a lot of them practicing the hand wash, hand hygiene, sanitizing their hands. So everyone is exposed to it. So that's what.
Okay, madam. Thank you so much. Thank you for kind time for us. Thank you so much.
Good evening. I'm SYAMALA. I would be presenting about lecture demonstration about microteaching lah. Okay, so it's about tracheostomy care. Okay, the learning outcome is student will understand the importance of tracheostomy care and its impact on patient well-being. Students will be able to demonstrate the proper procedure of tracheostomy care. Student will identify potential complication and measures to prevent them. Okay, so next is table content. So this is the table content now. Introduction, the concept of tracheostomy care, the reason why a tracheostomy is and why it is performed. Next is the importance of proper tracheostomy care in preventing complication and promoting patient comfort. Demonstration steps involved in the tracheostomy care, including suctioning, changing the dressing and maintaining tube patency lah. Okay, next will be and in the end as usual conclusion. So the first thing is introduction, the concept of tracheostomy care. Okay, why we have to do tracheostomy care? Usually is refers to the management and maintenance of a tracheostomy, which is a surgical procedure that creates an opening in the front of our neck directly into the trachea, such as like windpipe. Okay, this procedure is performed when there is a need for an alternative airway lah. Usually when people having trachea block, they can't breathe lah, airway problems, okay. So tracheostomy care is crucial to ensure the well-being and safety of patients who have undergone this procedure. So the concept of tracheostomy care involves several important components including hygiene and cleaning. Proper hygiene is essential to prevent infection and complication. The tracheostomy site and the surrounding skin need to be cleaned regularly lah. So using, actually by that we won't use my soap lah. We'll use our dressing thing lah, such as like povidone, normosaline, and water lah. The inner cannula of the tracheostomy tube also need to be cleaned and replaced as per medical recommendation. So so suctioning tracheostomy patients often have difficulty clearing secretion from their airway due to the altered anatomy. Suctioning is the process of removing mucus and secretion from the trachea using suction catheter. This helps maintain a clear airway and prevent blockage. So next is tube changes. Tracheostomy tube need to be changed periodically to prevent complications such as tube blockage or discomfort. Healthcare professionals are typically responsible for performing these changes, but caregivers may need to assist in some cases. So like tube changes, right, usually maybe for 2 weeks we'll change, okay, if the patient still need this one. But if long term patient means we'll change them to like Shiley tube which they can remove, wash their inner cannula by themselves. So next is securing the tube. The tracheostomy tube must be properly secured to prevent accidental displacement. Special tracheostomy ties or securement devices are used to keep the tube in place. Okay, next is humidification. The natural humidification and filtration functions of the upper airway are bypassed with the tracheostomy. Therefore, humidification of the inspired air is often necessary to prevent drying and irritation of the airway. Okay, finally, monitoring and assessment. Regular monitoring of the tracheostomy site, the patient's breathing and any sign of infection or complication is crucial. Any changes or concerns should be promptly reported to the healthcare professions. Okay, so next is the reason why a tracheostomy is and why it is performed. A tracheostomy is also known. A tracheostomy is a surgical procedure where a small opening called a stoma is created in front of the neck, and I guess same like just now. This opening provides an alternative airway instead of nose and mouth. So we're breathing through our tracheal. So a tracheostomy tube is then inserted into the stoma to maintain the airway and allowed to flow directly into their lungs. Tracheostomies are performed for various medical reasons. First is airway obstruction, and then next is ventilation support. Next is aspiration risk, surgical access, and facilitated weaning. It's important to note that a tracheostomy is a significant medical procedure and is typically reserved for situations where other methods of airway management or ventilation are insufficient or not feasible. The decision to perform a tracheostomy is made based on their patient-specific medical condition, needs, and expected outcomes. The procedure itself involves risk and potential complication, and the ongoing care and management of tracheostomy tube requires specialized medical attention, such as sometimes prolonged ventilated patient. So usually they'll perform a tracheostomy because cannot intubated for so long through via mouth so they'll do a tracheostomy usually. So in this case, like that.
Madam, one question. If let's say is a patient is a need for tracheostomy, if a patient is a need, for the prolonged ventilation prolonged ventilation. So once the tracheostomy is procedure is done, how long the patient have to need in the ventilation? I mean, how long after the tracheostomy done?
Depends on the patient condition in the first place. First, we have to monitor the SpO2. So we have to see if the patient progress is good, and then definitely they'll maybe they'll suture back the tracheostomy place because patient is okay. But if the patient is like quite long and very critical, they might have the tracheostomy for lifelong as well.
Okay, this situation is same for the PEDS patients, pediatric patients situations.
Usually will be same.
Okay, thank you.
The importance of proper tracheostomy care in preventing complication and promoting patient comfort. So proper tracheostomy care is crucial in preventing complication and ensuring the well-being and comfort of patients who have undergone this procedure. Tracheostomy care involves a range of tasks and practices aimed at maintaining the cleanliness of the stoma, preventing infections and promoting effective breathing. Here are some keys why proper tracheostomy care is important. First, obviously infection prevention. The stoma provides a direct pathway to respiratory system which increase the risk of infection. Proper cleaning of the stoma and tracheostomy tube helps prevent the growth of bacteria, viruses and fungi that can lead to infectious disease such as tracheitis or pneumonia, or sometimes they will have like ESBL also. Certain patient, if you take how we detect got ESBL through the section. So like how we give sputum, so we'll do the like suctioning tracheal aspirate. So next is mucus management. Patients with tracheostomies often have difficulty clearing mucus and secretion from their airways, which can obstruct breathing and lead to infection. Regularly suctioning and proper humidification of the air can help manage mucus and maintain clear airways. So this one how means usually sometimes the secretion all dry, and then it will make like a crusting and block the airway. So we have to remove the crusting all and do dressing usually like that. So when you removing the crusting, you have to be careful because you have to pull it out. You should not, when you pull it out, you have to grip it tight. If you leave it, it can enter the patient's trachea and can cause death as well. So you all have to be careful. Okay. Next is tube care and maintenance. Tracheostomy tubes need to be cleaned and changed regularly to prevent blockage and ensure proper function. A blocked or malfunctioning tube can lead to breathing difficulties and other complications. As I told you just now, what happened if the crusting block like that, right? Something like that. Okay, next is patient comfort. Proper tracheostomy care can significantly improve the patient's comfort and quality of life. Regular cleaning, suctioning and humidification can be reduced discomfort, irritation and breathing difficulties. Okay, next is communication and speech. Depending on the type of tracheostomy tube used, patient may have difficulty speaking. Proper care and maintenance of the tube along with appropriate speech therapy techniques can help patient communicate effectively. So especially we have to be careful, so sometimes patient newly done the tracheostomy, and if we never regularly suction or never care about the patient will have blockage and patient can talk. Talk is not a normal thing for patient who do newly tracheostomy. So it means it's blocked. So that's why patient can talk. Okay. So we have to be very careful. Don't think, wow, the patient is very good enough to talk after tracheostomy. Okay, next is prevention of infections. Okay, practicing good hand hygiene such as regular hand washing with soap and water can. Wait. Sorry, okay. Finally, now I'll demonstrate in tracheostomy care, including suctioning, changing the dressing and maintaining tube patency. Conduct a live demonstration of tracheostomy care using the tracheostomy care equipment, and I'll highlight the important points lah, such as proper hand hygiene, positioning the patient correctly, and using. Okay class, so now I'll be teaching you how to do dressing. Okay, dressing actually the same thing lah. So we have to remove this first. Okay, sila pasal ni.
Never do first.
So we ask, okay, Pakcik nama apa? We ask to the patient and confirm back from the patient's name. We have to check the BHT and what is doctor orders lah. So usually if the wound is clean, doctor will order normal saline lah. Okay. So here I already prepare normal saline. Okay. So first we So next is we will remove it. Okay. So okay, as we know, one swab for one. Done. Okay. Usually we can cut the gauze, but we try to avoid when you do the ENT one. We will try to avoid because you cut sometime can irritate the wound. So we fold it like A shape like this. Okay. So we fold it like this. Okay. Fold and then insert. If you are convenient with the hand, can or use forceps lah. Okay, so it's like this also can. Okay. Okay, so next I would like to teach how to do tracheostomy suction lah. Okay. Usually, right, how we check for the catheter size is, okay, let's say we say this one is the 7.0. So 7.0 divide with 2 and then times 3. So that's how we find the correct suction. This one. Okay. So next is the vacuum. You have to set from 18 to 120 the pressure. So we should not insert too much also. Okay, you can cause bleeding. So you have to about 10 centimeters. You insert. Okay, insert. Okay, while you suction, press this. Okay, rotate slowly, and then remove it. Okay, now ask the patient, okay ke? Okay, and then again until the secretion reduce. Okay, so we ask the patient to cough as well. Batuk. Okay, and we do the same thing. Okay, once this one we leave and we. So that's all lah. And then as you know, we have to remove this. Okay, this thing should not be hanging lah. You should cover with something. And this remove as usual. Okay, that's it. Thank you.
Okay, madam, one question, madam. Okay, thank you for your explanation and the steps you teach us, like a very important steps, how to take care the tracheostomy patient. Okay, in case, I give for one scenario. Okay, patient A did the tracheostomy and warded. After warded, patient have to discharge. Once the patient discharged to the home, is it the wife or the patient relative can perform the tracheostomy care?
Yeah, definitely can. So
especially the suctioning.
Yeah, definitely can. So if patient having long term this one, we advise patient to buy the suction machine, and we'll tell them from what reading to what reading the vacuum is supposed to be, and we will demonstrate to them like how we teach to you all.
So is it the patient relative or wife will be follow the maintain the sterility of the procedure?
Usually at house they'll use disposable lah. They'll use disposable glove. That's it lah. But
so this kind of patient can expose to the infection rate?
They will have higher chances, but because they're doing the sterile, dressing is sterile, just that the suction they're using disposable glove, that's it. So otherwise, nothing much lah.
Okay, madam. Thank you so much for the class.
Thank you. Welcome.